Afternoon. I'm here just to bring a topic that all of us are exposed to every single day of our lives. And misophonia is totally correlated to this topic, noise-induced hearing loss. Do you know why? Because noise is in every single place around the world. Isn't that true? Don't we all work with noise? Don't we all are exposed to noise? So my first question was, public health programs and campaigns can present and educate all about the risks of being exposed to noise at the workplace and also how to prevent it in NIHL. But how effective and productive is the work done in additional effects and consequences in a normal hearing versus overall healthcare in the working programs? For example, who is talking about tinnitus and misophonia in a hearing conservation program? Very few people. Let me tell you in advance, I work in Latin America, from Mexico all the way down to Argentina, and also in the United States. We have two different perspectives, two different types of work. In Latin America, it's pretty much unknown misophonia. When I go and talk to them, I say, miso who? Miso what? Misophonia. So I need to start to train and educate our own colleagues, right? But in America, in the United States, it's totally different story. So I wanted to tell you that these two, definitely tinnitus and misophonia, are totally correlated. Please don't ever disregard that if the patient is telling you, oh, I have tinnitus for so many years. He can probably have some misophonia. But we just need to investigate. So when we talk about noise at work impact, we talk that exposure to noise at work always going to damage the health of the worker. When we're talking about this damage, is only about hearing? No. What about blood pressure? What about when we're talking about emotional? These patients with hearing difficulties from the work side always have those issues. Let me tell you this. The most well-known effect of noise at work is loss of hearing, noise-induced hearing loss. And all of us are exposed to physical risks, hazards, right? Which one is the one that is present in all the world, around the world? Noise. And noise, what that's produced in a long term? Hearing loss. And what is the symptom that we always have associated with hearing loss, noise-induced hearing loss? Tinnitus. And accompanied, it goes with many cases of misophonia that are linked to tinnitus based on being exposed to noise in the work site. When I tell you this, is about 20% of adults in the US, which is 50 million people, almost nothing, right? Report some degree of hearing loss. In older people, hearing loss is often confused with or complicates such conditions as dementia. Do you know what are the big confusion, especially in the Latino community, when we're trying to identify if you're really a case of dementia, Alzheimer, or if you have some other errors or some other conflicts or symptoms that are affecting your hearing health? Right? We don't know it. We definitely don't know it. Hearing loss is the third most common physical condition after arthritis and heart disease in the United States. In Europe, which it's in my presentation, but I'm going to tell you, it's the occupational health hazard number 1 is hearing loss induced by noise in Europe. There it goes. It's the most common occupational disease in Europe, accounting for about 1/3 of all work-related diseases, ahead of skin and respiratory problems. NIHL is usually caused by prolonged exposure to loud noise. All of us know that. The first symptom is normally the inability to hear high-pitched sounds. We all know it. But what does it cause when I'm trying to identify more than just a hearing loss induced by exposure to noise? Doctor, I hear ringing. I hear. Okay, and what does it produce? Anxiety was mentioned here. I get so angry because I cannot focus at work. I was talking with my colleague in Latin America. Unfortunately, since this is a very new term and very new concept, we have to be very careful dealing with this information with patients. What I was telling you is, I usually don't tell them more than what they need to know. Okay? Because I don't want them to come and tell me, oh yes, I had that miso-ha, I had that one. No. Let me identify first if you have a hearing loss induced by noise. Let me see if you have tinnitus. And after that, I'm going to keep on going deeper and deeper to see what's new in there. When we're talking about noise-induced tinnitus, is contribute to hearing loss is a cause of tinnitus. This is a cause of tinnitus. This may happen if you're exposed to loud noises, either for a single event or ongoing experience. What's the big issue when we are exposed to noise? The difference in your hearing gets to you after so much time of exposure. Is that the same correlation when a misophonia case comes up? Could be or couldn't be. One question for you, my audience. Such noises can damage the fragile hair cells, and hearing loss can further aggravate the effects of tinnitus. And remember that tinnitus is not a disease, it's a symptom. So many of the symptoms can always be very confused with misophonia related symptoms, what the patient is coming to me and telling me. Oh, I have this. Is it a real tinnitus or it's a misophonia case? Or it's both? I need to know, for example, tinnitus, I want to get something from here. Tinnitus can be the first sign that your hearing has been damaged by noise. And what happens if the patient comes to me and tells me it's about a misophonia feature and not a tinnitus feature? Is his hearing affected? But he's been exposed 20 years to noise at the worksite. And his hearing is being affected. He's showing me already hearing noise-induced hearing loss, but no tinnitus, but misophonia. It's very interesting, right? Because none of us, or many of us, don't go to the work sites to work with this risk factor, noise. Tinnitus can also be resolved for a number of health conditions. As you can see, as I tell you, this is of heart or blood vessels. Many diseases, brain tumors, hormonal changes in women, thyroid abnormalities. And many of these are also associated with the ethnicity and origin of the patient, how they come. I cannot compare when I get an African American patient, when I get a Caucasian patient, or when I get a Latino patient. I always have to make differences in terms for me to see what can I take in or out of this study. What other effects can noise cause? In the UK, assessment amongst audiologists shows a high proportion of male workers exposed to loud noise suffer ringing in the ear. Likewise, amongst the female workers assessed, a number of workers also report this health problem. Let me tell you this is pretty evident, especially in the working community. When we go to the factories where people are heavily exposed to noise, most of the workers in the plant are males, not females. Like for example here, among women, the relationship to duration of noise exposure was less than male. On the basis of the risk estimates made and the prevalence of occupational noise exposure in the sample, it was estimated that nationally some 153,000 men and 26 women aged between 35 and 64. What are these ages? These are work age, where they are capable to work, to go to the plant and be able to work. I also have that has severe difficulty of hearing attributable to noise at work, and that 266,000 men in comparison to 84,000 women in the same age group. Let me show you this chart. As you can tell, the biggest population that is always affected was between 55 and 65. based on what I've seen, the most cases of tinnitus and misophonia associated and separately are between 55 and 65. Why is that? Because they've been exposed to more time to noises and at the work side. And they have been just coming out here in the population that I work with to be patients to work with cases of misophonia and not like just tinnitus, like they always were treated like. Based on that, this is in the UK, but I'm also making a comparison what is in Latin America. In Latin America, it's been, the way I've seen it, it's been misdiagnosed. It's been given a bad label for what I just explained. This is a new topic and it's coming into the community, so that's why. And this is with women. As you can see, between 45, 54 years and 55 and 65 years, they got all the same symptoms. And this is important that we always talk about non-auditory effects of the noise, and the World Health Organization says that noise in the environment or community seriously affects people. When we're talking about affects people, it's just about tinnitus? No. When we talk about pain and hearing fatigue, to my colleagues that have been working with misophonia, let me ask you this. Don't they come and say, I don't know, sometimes when I hear that, it feels like it's tiring. It hurts, right? And it's one of those. Or annoyance, or interference with social behavior, which is what we do with the CBT, right? Aggressiveness, protest, and helplessness. Another ones that are no auditory effect of noise are interference with speech communication. I don't know about my colleagues, but I have had patients with misophonia, and they come say, when that sound triggers, it's hard for me to hear so-and-so voices in so-and-so places. So it's also impeding him or impeding her to be able to speak, having speech communication issues. Sleep disturbance and all this. All this, the non-auditory effects of noise, as you can tell, are applicable to both tinnitus and misophonia. What some of those that trigger sounds in misophonia? Do you see the one that is in red? Environmental sounds. When we talk about environmental sounds, we're only talking about the birds, the traffic, the ring, the bell at home. Environmental is also where you go to work and all those noises. What about the machine that you're at your work site and it's not very well fixed? You come and do maintenance to that equipment, and that patient comes to you for your CBT. Because that little noise that the machine had was a pleasure for him or for her. But it doesn't have it anymore. It's noise effect, right? Not tinnitus, but yes, misophonia. Follow the signs, protect your hearing. How? Walk away from the noise, turn down the volume, wear ear protection. I don't know if you have noticed, but at the bottom of my slides, it's been always October. It's National Protect Your Hearing Month, right? In the US. These are my references, some of them. There are many more available I can share with you. But let's take care of our hearing and enjoy the world around our environment. Thank you.
Thank you, Dr. Fernando.
Mm-hmm.
So, have you had cases that their misophonia triggered tinnitus?
Actually, no. The other way, yes.
Okay.
Tinnitus triggers misophonia, but no misophonia to tinnitus.
Okay, so we have a case that we are hoping to publish it, that this person is a young girl who develops tinnitus after she hears certain sounds, such as like the speech of her grandmother.
Mm-hmm. But is this a temporary tinnitus or how?
But it was an auditor that required for her to, it doesn't continue, but she perceives tinnitus after she's exposed to those triggers, which are not loud, of course. So we need to find some sort of correlation between that type of
Thank you.
tinnitus triggered by misophonia.
That would be interesting, but I wanted to suggest to go a little bit more into her origin, where she's coming from.
She's actually, her parents are from Nigeria,
okay.
and she's
first generation English.
Yes,
Okay.
she speaks English, but it is interesting that whenever she hears her mother talks to her grandmother in Nigerian, it triggers that misophonic
You see
response. So it triggers tinnitus.
Yeah, but it could be a sound.
There are other sounds also. There are other sounds, but one of the sounds is the speech.
Huh. Yeah. And on this scenario that you placing, thank you for bringing that example. I want to bring to all of you now, with the new decade of migration around the world, in the United States, there are lots and lots of new cultures. Me being a male doctor come to you and say, "Hi, no, I can't. I said, why is that? Because you're a man. I'm not allowed to be in a room with a man. I cannot look at the eyes of a guy. Your voice is too loud. I can't." Those little things are the ones that I'm always telling you for all of us to pay attention to when we're treating one of these patients, because we don't really know where they're coming from. We don't really know what their origin is, what his origin is, and what it could develop later on in life.
Yeah, thank you for an interesting talk. I wonder if in your clinical observations you have ever come across with people that are triggered by misophonic sounds, and at the same time some sort of positive emotion or positive sensation also triggered in them. Like in one of our studies we found that like something around half of our participants also experience ASMR at the same time, autonomous sensory meridian response.
Mm-hmm.
And very few of them also reported to have sexual arousal at the same time. And I wonder if you come across any of these.
Thank you.
Thank you.
Yes, I have, but not with sexual, no, not that part, no. But with happiness, emotions of joy, yes. I've had cases with patients that when they laugh too loud or too much, they got misophonia. I was like, what? They're triggered. They're so happy, and they got all kind of explosion of emotions, and if they get misophonia. Really? Okay, that's a special case. I've had two of those. It started the opposite, and the other one it was with a fly, the mosquito. That was the trigger. But I haven't had the opposite way. Never. So it goes from case to case, I will say, and also in Latin America, where I work on this, we don't have 4 seasons. In America, we do. So I'm always going to be exposed to all kind of cases because of that. So before I treat a patient, all the time, no matter if it's for research or for a clinical appointment, I always get very involved in who the patient is. What is he referred here for? Misophonia, possibility? Okay, let me go. Where is he coming from? And on and on.
Hi, thanks very much. I just wanted to maybe turn direction a little bit and ask you about whether you could comment on your opinion of the idea of sound-sensitive tinnitus, and whether this is actually just tinnitus and misophonia together presenting in the same patient, or where you think sound-sensitive tinnitus is actually again another separate entity of this auditory phenomena that we're dealing with at the moment.
Okay, I'm going to tell you what I understood. Okay, based on what I presented today, because I wanted to show you what we all are exposed to every day, but we never pay attention to it. Noise-induced hearing loss. Okay, most of the time, for a very, very high percentage, when we are seeing a patient for what is referred to as for noise-induced hearing loss, there's always going to be presence of tinnitus or tinnitus. Yeah. So what I try to do is go a little bit deeper and see if is there misophonia or not. What I was telling to our colleague, I try not to tell them more than what I have to. Okay? In the United States, we have some rules and regulations. In Latin America, we don't have any rules and regulations. So the more I tell you, the more you can use that information. Okay? So what I try to do is through a questionnaire, through informal observation, I tend to derive. I say, okay, this is possible a misophonia patient linked to tinnitus because of NHL. But based on your own observation and some formal observation with assessment, no? With audiological assessments. That's what I will do. But I will never expect misophonia because of noise exposure. I will always expect tinnitus. The problem with that is, because of my presentation with it, is that tinnitus has many other symptoms associated to misophonia cases. So I will make a follow-up to that kind of patient. Remember, if we're going to send a TRT, CBT to the patient, and what is coming along, and more and more and more. But it's based on developing the working with this patient a little bit more closer. Is that okay? Pleasure.
Thank you very much, Fernando.
You're welcome.